Good afternoon. Welcome to today's policy briefing of our Congressional Black Caucus Foundation Congressional Fellows. I am Nicole Austin Hillary, and I am the President and CEO of the Congressional Black Caucus Foundation Incorporated. I am so honored to have you all with us today. Today is so important, and the main reason why it is so important is because it provides an opportunity for you to get a peek at the thinking and development of the next generation of leaders here in our country. The CBCF Fellows Program provides an amazing opportunity to do what I like to call leveling the playing field. It ensures that young professionals in the early parts of their career gain opportunities to build their knowledge, their skill sets, their expertise by working with members of Congress on critical issues, on critical policy issues that will frankly shape our nation and provide a template for how communities can grow, become empowered, and move into the future. We are so appreciative to all of the members of Congress who support this program and have made it a continuous reality for us and for the fellows who get to benefit from it. We are also extremely grateful to the many sponsors, too many to name here today, but please know that we thank you and are grateful for all of the work you do and for the investment that you place in our fellows and in the CBCF. I want you to know that what you're going to hear today is the brilliance of these fellows and the culmination of the work that they are engaged in throughout their fellowship year. And that is the time that they commit. They commit to this program for a year in which they are placed in congressional offices, and they work on the issues that are cutting edge and that are vitally important to the American public and to the leaders with whom they get to engage on a daily basis. This is work that, again, will inform and empower communities throughout the country. And we are so proud of these young leaders and how they will shape how this country moves forward and how it will continue to thrive. We want to make certain that this work continues. And we are so looking forward to the future of this program and to what we know these young leaders will bring to the table and what they will be. So I thank them all for their incredible work. We are all looking forward to engaging with you today and hearing and seeing your brilliance on display. So without further ado, we're going to get started. And remember, building the future begins with building up and investing in our young leaders. That's what we're committed to. And we are thankful that you all are committed to the same thing and join us today in embracing and encouraging these young leaders.
Thank you, Nicole, for your powerful remarks. Hello, everyone. My name is Akela Jenkins McIntyre, and I serve as the director of the Leadership Institute here at the Congressional Black Caucus Foundation. Your support of CBCF's Leadership Institute is not taken lightly. Our esteemed fellows have done us proud with their commitments to social justice and their in-depth policy analysis. They have served on Capitol Hill, in Congress, on committees and subcommittees, with various nonprofits, and have conducted research on behalf of our Center for Policy Analysis and Research. Collectively, we have fellows whose areas of expertise include education, gender and racial equity, LGBTQ+ advocacy, maternal and child health, criminal justice, economic development, transportation, affordable housing, voting rights, trauma-informed care, childhood obesity, health equity, gun violence, just to name a few. This afternoon, you are in for presentations that will address so many of these topics that are critical to the advancement of the global Black community. We will now transition to the event that you have all been waiting for, starting with a few logistical details. Please reference the slides that are about to be shown on your screen. We will have 2 options of breakout rooms for you to attend, featuring different fellow presentations each time. Our first breakout room rotation will feature presentations from Shelby Birch, Dr. Cameryn Blackmore, Dr. Hillary Carruthers, Rachel Gentry, Haley Hoskins, Nkechi Alechi, Paige Jones, and Dr. Danielle King. Our second breakout room rotation will feature presentations from Javon Knight, Ayanakwe Omaragbon, Jasmine Payne, Chloe Scott, Kyle Shepard, Kyla Terry, and Brittany Thomas. Please reference the link that has been made available in the chat for details regarding fellows' presentation topics. Please also be advised that fellows will present for approximately 10 minutes before opening the floor for Q&A for another 10 minutes. Finally, please note that all breakout rooms will be recorded. During the question and answer segment of the presentations, please turn on cameras and come off of mute to engage with the fellows as we work to make the virtual environment as engaging as possible. Please mute yourself when moving in and out of breakout rooms, and please ensure that you select leave breakout as opposed to leave meeting when returning to the main room. It's an easy mistake to make. CBCS staff will be present in all breakout rooms to provide support, but please also see on the screen graphics that indicate how to ask for help should you need to do so at any point. We are looking forward to an incredible afternoon. The breakout rooms are about to open. Please reference the screen for a visual representation of how you can join your rooms. You will be prompted to join the room. You will be prompted to return to the main room in 20 minutes to allow for a brief intermission before second rotations begin. Breakout rooms are now opening. Happy listening and engagement.
Start recording. And I will also share my screen now. Okay, so good afternoon. I hope you guys are doing well today. I will be speaking about my thoughts regarding the WISEWOMAN program, which is a program that helps to increase access to preventative heart health measures for women. Before I begin, I would like to introduce myself. I am Cameryn Blackmore, and I am a NREI fellow here at the Congressional Black Caucus Foundation. I am a trained political scientist. I just received my PhD in political science over the summer from the University of Alabama. Since joining this fellowship program, I have been placed in Congresswoman Marilyn Strickland's office, where I worked on health equity portfolio. And I will also like to thank my sponsors, Boston Scientific, for sponsoring my fellowship. So the flow of my presentation, I'm going to open up with just some small thoughts regarding the impact of heart disease, not just on the country at large, but also on the Black community. I will then give a brief overview of the Center for Disease Control WISEWOMAN program, and then I will end with my policy recommendations, as well as give you guys time to ask me questions. All right. So heart disease, as many of you may already know, is one of the leading causes of death for all Americans. And even with the COVID-19 pandemic, it is still a serious issue that impacts the overall health of Americans within this country. And just to give you guys an overview of the impact of heart disease, every 40 seconds in the United States, someone has a heart attack. So this is a major problem infecting the overall health of our country. In particular, it is gravely impacting Black women, as about 50% of Black women die annually from heart disease, according to the American Heart Association. And according to the Centers for Disease Control, based off of the last set of data points they had for this issue, in 2017, heart disease was the leading cause of death for Black women. And about 22.8% of Black women that died within 2017 died from heart disease. And in particular, for me, this is a topic of importance because not only do I know people personally that have heart issues, but I've also lost someone close to me at the tender age of 44 years old, a Black woman, from heart disease. So I know this is a silent, deadly killer if you're not paying attention to your heart numbers. There are several factors that impact heart disease in the Black community. Most people know someone in their family or in their neighborhood who has either diabetes, hypertension, high blood pressure, or obesity. And also there are lifestyle factors such as unhealthy diet, physical inactivity, excessive alcohol use, and smoking. And I will touch back just shortly regarding how those factors have been mitigated by the Wise Woman program. But one of the main barriers to receiving adequate preventative health care measures is the lack of health insurance. As we know, our country has a growing issue with access to health care, which is compounded by the cost of seeking health care. And according to the Kaiser Family Foundation, 20% of Black women are uninsured compared with 16% of white women. And with Black people representing about 12 to 13% of the overall US population, there are a significant number of Black women who are uninsured. And this number also does not include Black women who are underinsured, which means that they have some sort of health insurance, but their health insurance is not adequate to cover needed healthcare services. Okay, which brings me to the Wise Woman program, which stands for Well Integrated Screening and Evaluations for Women Across the Nation program. This is a program that is designed to provide a program of last resort for low income, uninsured, and underinsured women ages 40 to 64. This program not only provides education, but it also provides healthcare access to receiving some services to kind of seek out the risk factors of a woman's chances for receiving some type of complications to heart disease. And then it puts them into a program where they're being monitored, not just by healthcare professionals, but also in some parts of the country, they receive other outside services that I will touch on briefly, shortly. So in my opinion, Congress should expand Wise Woman. Why? The first point is currently it's been implemented in 21 states and 3 tribal organizations. However, we know that heart disease is a nationwide problem. It's not just a 21 state issue. So that's the first point. My second point is this program is culturally competent, which means each state, once they receive grant funding from the Centers for Disease Control, they have the autonomy to implement and design this program in ways that best fit the population that they're serving. So for instance, the program in Louisiana will not look like the program that's in Washington. And also, I will also like to take time to just note that if you look at the map, there are key southern states that are not receiving or have not received funding to implement Wise Woman, such as Mississippi, Georgia, Tennessee, Kentucky. These are key southern states that do not have access to Wise Woman currently due to budget constraints. The program is a success. 43.5% of women in the second year of Wise Women were maintaining blood pressure controls at levels that greatly reduced the risk of heart disease. So the women that were in the program that received treatment of some sort did receive a greater healthcare outcome because of their participation in this program. There's also a key financial component to this. So if you look at the right, overall, during the fiscal year 2016, the United States spent $363 billion on costs associated with heart disease. However, the current budget for Wise Woman is about $27 million. So even if the program increased, the budget doubled to $54 million, that's still not touching this overall cost of fighting the disease once it's already impacted citizens within the country. And this leads me to my overall policy recommendations. Of course, I'm in favor of increasing funding for Wise Woman. Once the funding is increased, not only can it be offered in more states, or more states will have the opportunity to get this grant funding, but also more communities within the states that have high concentrations of Black women can also have this program. So for instance, in Louisiana, the program has been implemented in the New Orleans area, but not the Baton Rouge area. So women in the Baton Rouge area do not have access to Wise Woman. I also am in favor of lowering the age of Wise Woman from 40 years to 35 years. And 35 years is the age that the CDC recommends the program be lowered to now, based on research that suggests that if a woman who has some type of risk factor associated with heart disease receives some form of intervention at the age of 35, their chances of experiencing serious complications later in life from heart disease are greatly reduced. Hey, so thank you, guys. I would first of all like to thank the Centers for Disease Control, Division of Heart and Stroke Prevention, as well as the American Heart Association and Boston Scientific for helping me prepare for this policy briefing. My contact information is listed below, and I will open the floor for questions. So you can just take yourself off of mute and ask me questions as you see fit. There were some points that I did not get a chance to make within my presentation. So I'll just see what the questions are, because you guys might give me an opportunity to make those points.
So hi, Cameryn, that was a wonderful presentation. Thank you. Question for you. I was noticing that the 2-year outcomes for women that were enrolled in the Wise Women program was 45.2%, I believe was the number. And did you have any sense of how Wise Women, the program, is performing versus other programs such as National Diabetes Prevention Program? I just wonder that 45.2% relative to other programs, how is it performing?
Oh, great question. I have not received any information regarding other programs, but what I can tell you is that the outlay of the program allows for women to come into the program, receive their screenings, and from there, they're issued a risk factor kind of category. So those women that fall higher on a higher end are receiving connections to healthcare professionals, nutritionists, different services depending on the state. And so that's where you see that 43.5% number, because they're actually being connected to a team of professionals that will monitor them to ensure that their needs are being met. And of course, not every woman can benefit from this program, given like genes and, things, genetic issues and things of that nature. But I think it's a great program because it provides them with access to a full team. It's not just, okay, we check your services and then, we check your numbers and then you can go on about your business. It's like a full integration of both education as well as healthcare services.
Thank you, so helpful, thanks.
No problem. Okay, if there's no other questions, one point that I wanted to make, I wanted to go back and discuss that cultural competency programming more, because I also think that that is another aspect that makes this program very, very valuable. So within the state of Alabama, for example, they decided to take the social work approach to implementation of Wise Woman. And so what that looked like was not only were these women receiving information regarding their heart health, but if they had issues such as housing, food insecurity, any mental health issues, they were also connected with services to help them in those areas too. And I think that that is important because a lot of those issues that we see women dealing with, such as not having access to healthy food or maybe not having housing of some sort, that contributes to their ability to be able to take care of themselves. I mean, how can you take care of your health if you don't even have a home or if you don't have electricity in your home? So I think that this program is great for giving states the opportunity to decide, look, this is what we view as the problem, and this is how we want to go about solving the problem. And we know the problems are the same yet different. So in certain parts of the country, you know, and I also like to focus on those southern states because we know there are large populations of Black people there. And also we know that the diets are a lot different in the South than they are in other regions of the country. So it allows the states to decide how they want the program to be implemented. And I think that's another key component as well of this program.
Hi, Cameryn. I apologize for not being on camera, but great presentation, and thanks for the work you're doing. Just curious about the funding level. You talked about the current funding level. Has the CDC talked about what level they'd like to be funded at, or do you have a recommendation about that?
I mean, they have not said what level they would like to be funded at, but they do support, obviously, an increase in funding. And I mean, to me, I know this country spends a lot of money, but to me, doubling the budget at least so that we can get the number. And the website says 21 states, so I kept it at 21 states, but I think the program is roughly in 27 states. So even doubling the funding for the program will allow more states to participate. And I didn't have enough time to review that in my presentation either, but this program is a grant funded program. So they put the proposal out and states can decide whether or not they want to apply. Then once the state applies, you know, not every state is going to get the funding based off of current budget constraints. And so I think by increasing the funding, not only will you see more states applying for the money, but then the CDC will be able to award more grants, and this program can be present in more states. I mean, it's literally named Women Across the Country, but this program is not across the country.
So a follow-up question, and it's implemented at community health centers, I guess, is that where it's implemented, or in private setting? How's it implemented?
In community settings, and I think that's going to look different across each state as well, based upon like what department in the state decides to go after the money. So I know in particular in Louisiana, it's implemented in the city of New Orleans. And so, but I'm not sure if it's like a state agency in New Orleans or like a local government agency that is running that program in New Orleans.
Got it. Thank you.
Yes. And then that's another issue with the program too. Even in the states that have the programs, not every, you know, area is covered. And so you're covering metropolitan areas, but what about the rural areas where we know the access to healthcare is even worse? So I think that's another important point to note.
Cameryn, can I ask, is there a forum where best practices are shared state by state or grant by grant? Because you mentioned social workers. I often hear community health workers. I've run programs with community health workers and seen their effectiveness. Just curious, how is best practices, best in breed being shared? So
that's a great question. The CDC has like an overall model, but they're very particular and conscious about letting the states like adopt their own flow, which I think is also another great component because like I stated before, it allows the states to decide how to best meet their needs and it's not restricting. You know, a lot of states are, they don't want to take grant money from the federal government because they don't want the federal government telling them what to do. And, you know, whether I agree with that or not, this program, you can't say that because the states and the local entities can literally decide what they want this program to look like. So they kind of give like the overall, you know, these are the health screenings you should be doing and things of that nature. But the actual what the program will look like, they allow the states to adopt that model. think we have like one more minute. Any other questions?
Yeah, I would just say I find that often in those DC-based convenings, like National Minority Healthcare Foundation or the CBC itself, those have been really vital places to hear what people are doing and what's really having success. So I'm glad you're in DC. I hope you keep having success and promoting, equitable care. So thank you for this presentation.
Thank you so much, Paige, and definitely thank you all for deciding to come to my session and hear my thoughts on Wise Woman. Once I learned about the program, I think it's a great program, and I really would like to see an increase in funding for the program and just the program be able to like really branch out and do that needed outreach to get women into the program. So